that heavy feeling in your legs after a long day, or that slight swelling that sometimes appears. These common occurrences point to a lesser-known system in our bodies, the lymphatic system. Unlike the heart, which pumps blood, this system operates without a central pump. Welcome to New Pod. Make sure to subscribe now so you don't miss any of our episodes. To understand lymph, we first need to take a close look at our blood circulation. The heart pumps oxygen-rich and nutrient-rich blood into the arteries. These arteries branch into finer and finer vessels, called capillaries. At these capillaries, a portion of the blood's fluid, known as plasma, passes through their walls to directly nourish our cells. This fluid, called interstitial fluid, bathes all our tissues. After nutrients and waste have been exchanged, most of this fluid is reabsorbed by the venous capillaries and returns to the heart. However, a small part remains in the space between the cells. This excess fluid is what forms lymph. It can't accumulate indefinitely, so another system must take over to drain it. This remaining interstitial fluid is collected by a network of vessels parallel to the blood circulation, the lymphatic system. It all starts with lymphatic capillaries, tiny vessels that begin as blind-ended tubes deep within our tissues. Their structure is specifically designed to absorb the surrounding fluid. Once inside these vessels, the fluid changes its name and becomes lymph. So, it's not a mysterious fluid, but rather a component that comes directly from our blood. This initial collection network then merges into larger vessels, called lymphatic collectors, which transport the lymph throughout the body. The lymphatic system acts as a secondary drainage circuit. It's essential for maintaining fluid balance in our body and preventing tissues from swelling. Unlike blood, the lymphatic system doesn't have a central pump like the heart. So, its fluid, the lymph, relies on other mechanisms to circulate. The most important of these is muscle contraction. Every time we move, like when we walk, our muscles tighten and squeeze the lymphatic vessels running through them or nearby. This pressure pushes the lymph forward. That's why regular physical activity is so important for good lymphatic circulation. Breathing also plays a key role. When you take a breath in, the movement of your diaphragm creates a suction effect. This not only pulls air into your lungs, but also draws lymph into the large lymphatic ducts in your chest. So, walking and breathing act as the two main, natural pumps for our lymphatic system every day. Besides these external factors, the lymphatic system also has its own built-in propulsion mechanism. Once they reach a certain size, lymphatic vessels have muscle cells embedded in their walls. These cells contract on their own in a rhythmic way, similar to the process of peristalsis in the gut. Each section of a vessel, located between two valves, is called a lymphangin. It contracts to push lymph into the next section. You can think of it as a chain of tiny, decentralized hearts, ensuring the fluid keeps moving continuously, even when the body is at rest. This internal pumping action, combined with the pressure from our muscles and breathing, allows lymph to flow upward from our feet to our neck, working against gravity. From there, it finally returns to the bloodstream at the base of the neck. Lymph needs to move up through the body, against the pull of gravity. To help with this, lymphatic vessels have a clever system, valves. These are small flaps or folds in the inner wall of the vessel. They are placed at regular intervals. These valves work just like one-way doors. When a muscle contraction or the vessel's own pulse pushes the lymph forward, the valves open to let it pass. But if the fluid tries to flow backward, the valves snap shut, blocking its path. This system ensures the lymph always flows in one direction, from the body's outer tissues toward its center. This is what allows the system to work so well, even without a strong, central pump. Sometimes, this drainage system doesn't work properly. If the lymphatic vessels are damaged, missing, or just overwhelmed by the amount of fluid they need to drain, lymph builds up in the tissues. This is what's known as lymphedema. It's important to use this term correctly. It specifically refers to a buildup of lymph due to a failing lymphatic system. You shouldn't confuse any random swelling with lymphedema or automatically call it water retention. Likewise, the idea that lymph becomes stagnant and fills with toxins to be flushed out is misleading. Lymphedema is a medical condition that results from a mechanical fluid imbalance, not from a buildup of poisons. Managing it requires a precise clinical diagnosis to understand its cause. For a confirmed case of lymphedema, manual lymphatic drainage may be considered. This is a gentle massage technique designed to stimulate lymph circulation and help reduce swelling. However, it's crucial to understand that this is only one component of a comprehensive treatment plan. For lymphedema, Treatment mainly relies on compression using special bandages or stockings, specific exercises, skincare, and patient education. Manual drainage alone has not shown a consistent effect on reducing volume. So, you shouldn't expect it to cure the condition, cause fat loss, or detoxify the body. Furthermore, it is not recommended as a routine preventive measure for lymphedema after breast cancer. Its relevance must be evaluated by a qualified healthcare professional as part of a complete care plan. Before considering drainage or any other procedure, a medical diagnosis is essential. Swelling is not something to ignore. It can be a sign of a serious underlying condition. This information is for general purposes and is not a substitute for professional medical advice. Certain signs should prompt you to see a doctor right away. Be on the lookout for any swelling that is new, persistent, appears suddenly, or is painful. Redness, a localized feeling of warmth, a fever, chest pain, feeling faint, or unusual shortness of breath are all serious warning signs. If you have any of these symptoms, you must stop any massage and get medical help immediately. Before your appointment, try to note when the symptoms started and how it has changed. You should also prepare a list of your medical history and any medications you're taking. Lymphatic drainage can be a helpful tool, but its use is only appropriate after a proper diagnosis. Lymphatic drainage can be a helpful tool, but its effectiveness relies on an accurate diagnosis and realistic goals. Our next episode will explore the differences between edema and lymphedema. Subscribe to New Pod to continue exploring these topics with us.